Mental health is something we all have. It includes your emotional, psychological, and social well-being. It affects how we think, feel, helps determine how we respond to stress, relate to others, and make choices. Mental health problems are common. In 2019, 50 million Americans experienced mental health problems. More than half of those didn't receive treatment for those problems that they were experiencing. We all know physical health is important. It's something we need to look after so we can stay fit and well. If you're experiencing problems with blood pressure or diabetes or really any other physical health problem, oftentimes people seek out the appropriate treatment. Seeking treatment for your mental health is no different, just as we do for our physical health, so that we can think and feel the way we want to and really have a more enjoyable future. If you're wondering if you or someone you love might be experiencing signs or symptoms of depression, anxiety, or any other mental health disorder, some early warning signs often include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, smoking, drinking, using substances more than usual. Reaching out for help can be scary, uncomfortable, awkward, but there's a lot of people willing to help. You can reach the crisis text line by texting TALK to 741-741 or call the National Suicide Prevention Lifeline at 1-800-273-TALK. Riverside Behavioral Health Center is open 24/7. As always, we encourage you to call 911 in the event of an emergency or go to your local emergency department. If ever there was a time to invest in your mental health, it's now. Let's talk about it. Hi, thank you so much for joining us tonight for Let's Talk About Mental Health, where we will be talking about both adults and adolescents and navigating both mental health and mental wellness. I'm Stacy Johnson, president at Riverside Behavioral Health Center. Here with me tonight is Dr. Ryan McQueen, the chief of behavioral health, and Jonathan Cawthon, a licensed professional counselor. Dr. McQueen is born and raised on the peninsula. He moved to North Carolina where he completed his residency and a specialty in child and adolescent psychiatry. After spending some time in North Carolina, he decided he wanted to come back and work in the community that raised him. Also on the line is Jonathan, who's also born and raised on the peninsula. Jonathan's dedicated more than 20 years of his career to both adults and children and providing services across the counseling spectrum to include everything from substance abuse to depression, anxiety, and family services. To start off, I'm going to turn it over to Dr. McQueen, who will educate us and help us learn a little bit more about adolescent services. Okay. Hi, it sounds like we're having a little bit of technical difficulties as we're not able to hear Dr. McQueen. So Jonathan, I'd love to turn it over to you for a minute to talk about adult mental health services, and then we'll go back to Dr. McQueen. Thank you.
Certainly. So what we provide through adult mental health services, that can range from anything from individual counseling services, addressing substance use issues or depression or anxiety, as you mentioned, as well as more group-related services. There's sometimes with mental health needs that the group process can actually be more effective in addressing their needs than what maybe they might experience through individual. And as you might be able to see in this slide, an estimated 26% of Americans ages 18 years or older, that's about 1 in 4 adults, suffer from a diagnosable mental health need, and that's over a given year. And many people suffer from a disorder at a given time that can relate to depression, anxiety, and a lot of times that these needs, they co-occur with substance use, or depression and anxiety can occur at the same time. And services on the adult spectrum try to address that, whether it be between individual, group, or even medication management. Another aspect of that service is regarding family work, in which therapeutic services are meant to help address family needs and family dynamics and how they can relate to some of the mental health needs that someone's experiencing related to various different stressors. And as you can also see in this slide, approximately 9.5% of American adults will suffer from a depressive illness, whether that be major depression, bipolar disorder, or dysthymia in a year. And we're seeing that more prevalent. With the advent of COVID, we're seeing an increase in the amount of depression, anxiety, and other mental health needs than ever before. As well, we can state that women are twice as likely to suffer from major depressive issues. However, both men and women are both likely to develop a combination of bipolar, either type 1 or type 2. While major depression can develop at any age, the average age is about 20 to 25 years old. And it's really important to be open to exploring the dynamics of assessment and evaluation of these needs, because it's very common that people sometimes experience these stressors and experience the symptoms of anxiety and depression and have no idea that they're going through it. And that leads to that stigma of concern about what does that mean to have depression? What does that mean to have anxiety? And realizing that having anxiety and depression is no different than having diabetes or heart condition that you have to manage. As mentioned as well, but with bipolar, which affects about 2.6% of Americans, the age of onset is also during the 20s. So there's a lot of area there within the early to mid 20s in which people experience some symptoms of mental health needs. As well, approximately about 18% of people between the ages of 18 and 54 have an anxiety disorder. And this can range from panic disorder, OCD or obsessive compulsive disorder, generalized anxiety disorder. And so it's just very important to be able to identify these symptoms early so that through individual, group, and also medication management, those type of symptoms can be addressed. Now, these type of needs are not necessarily something that, quote, can be cured, but they can be managed and treated through these different modalities. So again, it's very important to increase that knowledge base and understanding about what these different mental health needs are and to be able to communicate about them openly. In addition, approximately about 1% of Americans are affected by schizophrenia. Now, schizophrenia in and of itself can be a pretty scary word to some people. What does that mean? What does that entail with the aspects of schizophrenia? And in most cases, schizophrenia first appears in men during their teen years or early 20s, or, in women, schizophrenia can also typically start to appear during the early 20s and 30s. And sometimes it's very subtle. So again, it's very important to reach out to support and reach out to services to help address those needs. What you're seeing here in this is about the impact that substance use has had. And substance use can sometimes be a very common coping skill that people use to address mental health needs. And as you can see in this slide, that from 2015 on, there has been a rapid increase of drug overdoses related to efforts made by people to cope with their mental health needs. And they end up overdosing on medications and other drugs. And that's what we're trying to avoid. That is the stuff that we are trying to address through the work that we do at Riverside Behavioral Health Center to use different modalities on trying to identify and treat mental health needs so that those type of situations reduce. And as we move forward, we look forward to what the pandemic has impacted us in what way. We talked about COVID and how that has negatively impacted how people get treatment and how they cope with the stress of isolation, financial stressors, and family stressors that come with it. And as you see in this slide, there has been a marked increase in symptoms of anxiety, depression, as well as a combination of both anxiety and depression. And as mentioned earlier, it's very common that when someone's experiencing one mental health need, it's usually co-occurring with something else, another mental health need like anxiety or excessive irritability or substance use. This next slide kind of represents a further understanding of how the impact of the COVID-19 pandemic has impacted mental health needs over the last 2 years. As you see from the period of May through July, there was a marked increase in anxiety and depressive symptoms. And in this slide, what you'll see in that first bar in the brighter blue is that's the level of anxiety over the period from May through July. And as you see, it has had a marked increase. The second bar indicates depression. And the third bar indicates a combination of how anxiety and depression have increased over the period of just a few months in the year of 2020 due to the COVID-19 pandemic. And the impacts on how COVID-19 has affected how people obtain resources. And as you can see, it's increased the delays and interventions that are provided. It's increased wait times between receiving services. There can be a long delay between contacting referral sources like outpatient therapy, inpatient treatment facilities, and actually obtaining the services. At times, there can be a length of time that needs to be taken in terms of testing for COVID prior to admission into certain programs. And that further delays a person's ability to get their needs met through mental health services. At other times, there can be issues with the state hospital outbreaks where there can be situations of COVID outbreaks within the hospital settings that can make it difficult to provide services. In addition, there's a social impact to COVID-19. Outside of what happens in the mental health facilities and with outpatient providers that I think sometimes gets overlooked. And as you can see in this slide, social isolation, I feel, is one of the most difficult impacts of COVID-19, where people are anxious and scared about leaving their homes, interacting with others. There's an increased disconnect even within family members that further increases the potential for depressive symptoms, anxiety, and bipolar disorder needs. There's job loss and financial stressors that come with that. And when we consider the impacts of COVID on the frontline workers, the nurses, the therapists, the doctors that are providing that frontline care, at times there's a lack of resources available to people who are in need of mental health services due to the COVID pandemic. And as well as I think a lot of families and parents particularly can understand that as they've experienced, the impact on the school and education sector has been very intense, where kids are doing homeschooling and virtual learning, where there may not be as much socialization with their peers. There's increased responsibility on both parents and children to navigate those stressors of education in a very different way. And that can lead to a multitude of mental health needs that we're starting to see more and more often, even at Riverside Behavioral Health Center, that increase that need for services and supports. And as you can see from this next slide, more than 50% of adults in the United States report that their mental health has negatively been affected by COVID. I mean, just think about that. 50%. That impact on COVID alone is just astronomical. And we're seeing that all the time. And that's why it's so important to have this conversation like we're having today, so that people can remove the stigma of not knowing, what do I do in this situation? Where do I go? How do I get the help I need? Or even just recognizing the need for help. That to say, this is the time to call. This is the time to reach out for support because this is real. This is something important to address. In addition, looking at this next slide, this again reinforces what we've been talking about the symptoms of anxiety and depressive disorder. And this is within January to June of 2018 versus January of 2021. So within the last 3 years, such a dramatic increase in instances of anxiety and depression just within a year span as impacted over the last 2 years regarding COVID. To see that dramatic increase from 11 to 41+% is astronomical. And that's why, again, it's so important to have this conversation about removing the stigma and recognizing the need for these services. So, what do you do? When you need somebody who needs that support, what do you do to help navigate those needs? And it's really important to have that open communication at first and foremost. Even if you're not quite sure how to communicate about it, just letting someone know that something isn't right. And if you're able to communicate depression or anxiety or increased irritability, that is that first step, whether it be with a loved one or if being able to reach out to your primary care physician, or if you have your own outpatient therapist, really being able to be open about that and have that conversation. It's really important to be able to take medications as prescribed. I can't tell you how many times I've talked to patients that one of the biggest struggles is maintaining their medication regimen, whether that be just simply remembering to take their medication or being able to maintain the appointments associated with meeting with their doctor or psychiatrist to ensure that the medications that they're on are working effectively and doing what they need to do. Also, it's important to manage your own healthy coping skills, be able to take care of yourself, manage your eating healthy, hygiene, physical health is so important, just as important as mental health and how they're tied together. Physical exercise, regular interactions, and socialization are super important in maintaining overall mental health. And in conclusion, with what I wanted to share, I wanted to make you aware of what's available at Riverside. And one of the biggest areas is about that individualized approach, that when you come and you receive services with us, you're going to get that individual care that meets your individual needs, no matter what you're managing. There's group and family work that also is detailed and provides additional coping skills, parenting skills, communication skills that can be really helpful with managing the stressors that bring people to Riverside. We also provide case management services because even though people might need in a crisis to come to some place like Riverside for support, and we encourage you so much to do so, that the journey doesn't end there. Mental health is a lifelong process, just like your physical health. It is something that you deserve to maintain and take care of. And so we provide the service of connecting you with resources out in the community that can continue that work. In addition, as will be addressed a little later in our program, we provide substance abuse services as well, which include like an intensive outpatient program and our partial hospitalization program, which provide an additional layer of support for substance abuse needs.
Jonathan, thank you so much for sharing that great information. I really heard that folks aren't alone, and it's really important to reach out if they need help. Thank you so much. So
No problem.
I am going to go ahead and turn it back over to Dr. McQueen to talk a bit about adolescent services. Thank you.
Good evening, everyone. I hope you can hear me. So my name is Ryan McQueen, and first thing that we're going to talk about is what mental health is in adolescence. Stacy touched on it earlier, and it talks about emotional well-being, psychological well-being, social well-being. And then it affects how we all think, how we feel, how we act. It determines those things about us. And it can also affect us by determining how we handle stress, how we relate to others, and how we make healthy choices. But it can also determine how we make unhealthy choices. So in adolescence, we see a number of things. In the hospital, when I used to work outpatient, we would see a number of things. We would see depression, we would see anxiety, we would see adjustment disorders, attention deficit hyperactivity disorder, oppositional defiant disorder, intermittent explosive disorder, disruptive regulation disorder, bipolar disorder, substance use disorders. We see a lot of kids coming into the hospital using marijuana and other substances to cope with what's going on. But the two main things that we'll talk about today is depression and anxiety. So in regard to depression, about 9.4% of children between the ages of 3 to 17 years old, they have depression. And these are things that can be as simple as feeling sad, feeling isolated, feeling hopeless, helpless, useless, worthless. Some people talk about not enjoying the things that they used to enjoy, or the fun activities that they enjoy. There can be changes in sleep patterns. A lot of kids and adolescents will feel guilt. There may be changes in energy level, feeling less energy. Sometimes people will feel more energy. There may be problems with attention and concentration, and changes in eating patterns. And a lot of times, well, not a lot of times, but sometimes we'll see in kids, they're injuring themselves, or you'll see self-destructive behavior. So injuring themselves, we'll hear about and see kids who are cutting themselves or burning themselves. Other times, self-destructive behaviors include going out, using drugs and things. Next, we have anxiety. So about 4.4% of children aged 3 to 17 years old experience anxiety. And that's excessive and difficult to control worry. It's fears when they're away from their guardians. It can be phobias. And sometimes, we think it can be a little funny if somebody's scared of bugs or something like that, but it can be excessive to the point where the child or the adolescent is not able to go out and accomplish things that need to be accomplished. It can be fear of being in places with a lot of people or speaking in front of people, such as social anxiety. And then you can have anxiety attacks or panic attacks, where children and adolescents may have the sudden and unexpected intense fear or anxiety, and they'll have tremors, sometimes sweating. They'll talk about their heart is racing. They'll feel butterflies in their stomach, problems breathing, feeling like something bad will happen, or like a sense of impending doom, dizziness, and those are things that we see sometimes in anxiety attacks. So when you take all this and you total it together, it turns out to be about 8.5 million children in the United States who suffer just from anxiety and depression alone. So with children and adolescents in COVID-19, a lot of what we saw was anxiety, depression. Like Mr. Jonathan said, difficulty adjusting, there was loneliness. A lot of what kids need and adolescents need are that connectedness. So when kids are younger, we know that they tend to hang around with their guardians, tend to cling to their guardians more, to parents more. As they get older, kids start to branch out. When they become adolescents, older children, they start to, hang out with friends more, reach out to their friends more for advice, and sometimes other adults as well. But during COVID-19, a lot of that connectedness between friends and family members and other adults and trusted adults was lost. So there was a survey that the CDC performed in 2021, and you can see the name of it there at the top of the screen. It's abbreviated ABES. And about 37% of high school students reported that they experienced poor mental health during the COVID-19 pandemic. And 44% reported they persistently felt sad or hopeless during the past year. The important thing to remember right now is that we're all adjusting, we're trying to adjust to what's happening with COVID-19. But we have to remember that the pandemic is not over. There are schools that are still periodically closing down, and those children are still affected by those closures and that lack of connectedness. So is mental health preventable? Some mental health is preventable, but not all of it, because sometimes there's a genetic component, and we can't, change that component. But what can we do? So we can help children and adolescents feel connected in school, at home, with family, in the community. That may be with uh, going out with friends or other, events within the community. Try to prevent negative experiences, just like Mr. Jonathan talked about earlier about drug use with adults. You see the same thing in children, like I mentioned as well. You try to prevent those experiences. You try to prevent violence. And one big thing that we're seeing now, as many of you all are aware, is bullying. That's something that needs to be prevented as well. Let the child know that somebody cares about them. Talk to your child. Let them know that you care about them. Build strong bonds. Become involved in what the child is doing. If your child wants to play sports and that's something that you're allowing your child to do, then go to those sporting events with them. Cheer them on during the games. If they play instruments. It is just a huge deal for children to know that their guardians are there. Sometimes they can't see in the audience, but they know that. Help your child make healthy decisions and healthy choices. Again, spend time with your child and communicate openly, honestly, frequently. And also remember that communication is nonverbal. So for some children, and people show affection in different ways. Some children like hugs, some will come up and hug you, some like hugs. It just remember that communication is nonverbal, and that's another way to show your child support. So when do guardians reach out for help? So any of those symptoms that we mentioned before. So loss of interest, low energy, changes in sleep, spending more time alone, isolating, not wanting to do things, more irritable, more agitated. Any of those symptoms that you see on this slide now, or any of the symptoms that we talked about earlier, you want to reach out for help. Something else to remember is a lot of times when adults become depressed or they become anxious, sometimes adults will isolate. We don't always let children do that. If school is open, a lot of times we want our children to go to school. We want them to continue to participate in activities. So children sometimes will show depression differently. So one major thing to look out for is irritability, agitation. If your child has that change in mood, then it may be time to reach out for help. So how can Riverside help? Mr. Jonathan had a great slide earlier about how Riverside can help. But we can also determine, of course, if inpatient hospitalization is needed. If you're not sure, you can always call Riverside. You can always come to our behavioral health center. We have an admissions department and people there who are able to evaluate your child. Bring your child in there. They'll be evaluated. We can determine if your child needs to be in the hospital or not. If they don't need to be in the hospital, we can give you resources in the community. If they do need to be in the hospital, we have all the types of therapy that Mr. Jonathan mentioned earlier. Medication management, we have psychotherapy, we have group therapy, we have recreation therapy. Even for the kids, we have a school at Riverside, and it operates at about 3 hours per day. And the teacher there is really helpful. A lot of the kids like him because they're able to help them get through some of the work that they are missing at school. And also, he's helpful to help them learn things that they don't necessarily know. So I hope that you found this helpful. And I hope that if your child does need help, that you bring them to Riverside.
Thank you so much, Dr. McQueen and Jonathan. That was incredibly helpful. Both of you have mentioned substance use disorders and addiction throughout your presentations. So what I'm going to do now is turn it over to a video that speaks specifically to addiction services. At our BHC, we really focus on providing individualized and holistic care. If a patient's admitted to our facility or one of our programs and is struggling with both substance use and mental illness, then we have the team really structured to meet those individualized needs.
So the addictions programs that we have here are for adults, treat adolescents with addiction on an outpatient side. So we have 2 programs, generally lasting a few weeks at a time, where people go through groups. They can also see a medication provider as well, because of course with addiction sometimes there are other mental health issues that go along with it, and sometimes those things need to be treated as well. But those programs are for people who are addicted to any substance. So it can be alcohol, it can be marijuana, it can be cocaine. And if they come here, we can kind of screen everybody or screen that person to see if going straight to that addiction program is the right thing for them, or if we need to admit them to the inpatient unit first to detox and then transfer them to that program. It can be really hard on loved ones. I mean, to see their child, whether it's a teenager or the person is an adult, going through addiction and watching them literally go from sometimes a functioning person down to the point where they can't function is really trying for people. We have caregivers who want their child, or like I said, whether it's an adolescent or an adult, to go to an addictions program, and they don't want to. And they want this person to get better so that they don't end up passing away on the street or passing away from an overdose, an accidental overdose. They want the person to get better, but also the adolescent or the person who's experiencing it has got to want to get better. And if they don't want to, you can't make anybody do those things.
My past relationships with my parents, with my ex-husband, with my siblings, I think that it helps me to be more empathetic with my patients, kind of get a better understanding of how their addiction has affected others, and kind of give them some insight on what it could look like if it progresses, how it's maybe affected their loved ones in a way that they don't understand or just haven't recognized yet. So I think that the individual therapy portion, they're able to confront a lot of internal issues that maybe they're not as open to sharing within a group therapy. And then we have our peer recovery specialist who kind of takes that role as, I've been there, you know, I can help you see how to change or what I did. And then you have the therapists who are there to educate you on everything and tell you, you know, how this affects your brain, how this affects different organs, you know, the cycle of addiction, the relapse prevention models. We have other therapists who come in who do our recreational therapist. She helps teaches you mechanisms to do when you're alone and you're bored to help prevent that relapse from occurring. We have our pharmacists come in and teach you why medication management is so important. So I almost kind of teach patients how to live successfully a daily routine without using drugs and alcohol. Ways to cope with external and internal stressors, things to do to keep them busy and to take their mind off of intrusive thoughts. Educating them on the impacts of their addiction, whether it be alcohol or illicit substances, the different diseases and conflicts medically that it could lead to, like cirrhosis, wet brain, neuropathy, any kind of physical or emotional, you know, damage that drugs and alcohol do cause, because we know that once you're dependent on an illicit substance or alcohol, everything kind of shifts in the brain, and that's when your mental health starts to deteriorate.
So I like to say that I'm an emotional support human. I support people who are coming from active addiction into recovery. I told somebody the other day he had all these problems. He had court, he had another court, he had a probation officer, he has a parole officer, he has another ticket, he has his parents, he's all these problems. And I said, how do you eat an elephant? And he said, I don't know. And I said, one bite at a time. So we're just going to take one problem at a time and solve, you know, talk to the probation officer, find you a recovery home to go to. So he's going to go from bed to bed, and what that means here is from a bed in our hospital to a 30-day program. We want you to get better. Everything we do and say here, we want you to succeed. We care for you like we care for our own family. You can do this, that anybody can do this. If I can do this, anybody can do this. Because my family told me I was hopeless. I was hopeless.
Thank you all so much for sticking with us tonight. I know we've got a couple eager folks in our audience who would like to ask some questions of myself and the panelists. I think first I am going to turn it over to Kelsey.
Hi, I'm Kelsey. Thank you for the helpful information. There has been a negative stigma around mental health, but it seems to be changing for the better. How do we continue to fight the negative stigma associated with mental health?
Great question, and a very important one. If you don't mind, I'll take this one. It's a topic that I'm incredibly passionate about, and quite honestly, what our show is named after tonight. Let's talk about mental health. And I think that really that's what's first and foremost and so critical, is having these conversations. Let's talk about mental health. Let's talk about mental wellness, what we're doing to take care of ourselves. We want to really avoid judgmental conversations and really see what we can do to help empower and support our loved ones. Getting comfortable having conversations about mental health, just like a diabetic would with you know, their medical disorder. We want mental health to be as equally as comfortable, and it starts by both myself and you having these conversations with our loved ones. So really, really great question. Thank you so much, Kelsey. Okay, I think that we've got another caller on the line. Andrea, is Andrea ready for?
Hi, my name's Andrea. I have a question. The recent tragic deaths of female student athletes has raised a lot of questions about mental health. Can you recommend how we as parents can have conversations with our kids and encourage them to have conversations with their friends? Thank you.
Sure. Absolutely. Again, a really critical question that I think many of our viewers are thinking tonight. Dr. McQueen, would you like to answer that one?
Sure. So what I would say in having a conversation with your kids is be open, be honest, Be genuine, be humble, and question. Question, question, question. Ask them. Ask them outright. How are they feeling? Ask them about their mood. If you notice any behaviors that you see that are different, ask them about them. If they come to you and they approach you about the fact that they're feeling down or they're feeling sad or that they're feeling like they want to hurt themselves or they're self-harm, don't blow it off. Talk to them about it. If you don't know what to say, be silent. Just listen to them. Listen to them. And then once they finish talking to you, you can always bring them to the hospital, like we mentioned earlier, or you can seek help on an outside of the hospital basis.
Thanks so much, Dr. McQueen. Really great information. All right, I think we've got time for one more question from Alex.
Hi, my name's Alex, and I was wondering what I should do if I am worried a friend or a relative might be struggling with a mental health problem like anxiety or depression.
Sure. Thanks for that question, Alex. Jonathan, would you take a minute to answer that, please?
Sure, definitely. Just to pick up on what we've been talking about, one of the first things that I think is most important is communication. To be open to the individual, to be open to hearing what they're going through and the stressors that they're dealing with, and to sometimes just listen. I think Dr. McQueen made a very good point that oftentimes, even as therapists, I think we struggle with this, that we want to fix the problem. And sometimes all that people really need us to do is listen. Certainly in certain cases when there's concern for safety, whether it be harm to oneself or others, we do need to take action and we do need to move a little further. And that can range anywhere from continuing to discuss and process through what's going on. It can be reaching out to another friend or family member. If you already have an outpatient therapist or support worker like a mental health skill builder, reaching out and contacting them. And if needed, calling 911 or calling Riverside Behavioral Health Center is certainly recommended and supported because we want to take people seriously. We want to be able to seriously provide that support and that time in to ensure that they know and feel like they're validated, that they're important, and that their needs are taken seriously.
Thank you, Jonathan. Great answer, great insight. We really appreciate it. So I'd just like to say thank you to both Dr. McQueen and Mr. Jonathan for taking the time out of their day to share this information with all of you. And of course, thank all of our viewers for joining us here tonight. So I encourage you to all keep the conversation going, be part of the change, and really getting comfortable talking about mental health and wellness. If you'd like to learn more about Riverside and the services at RBHC, please visit riversideonline.com/RBHC. And let's be the change. Let's keep the conversation going. Thank you.